The specimen is one of the most important factors affecting laboratory diagnosis of mycobacterial infection. A good laboratory report is dependent on receiving a good quality specimen. Initially in the laboratory, all specimens are evaluated, labelled and entered into the laboratory computer system. Any inappropriate specimens are rejected and reported as such. A maximum of 30 specimens are processed each day in the IMRL. A good specimen should be taken before commencement of therapy, taken from an appropriate site, ideally should be 5 to 10 millilitres in volume, but not less than 2 millilitres, collected in an appropriate wide-mouthed container, so as not to contaminate the outside of the container. Sputa should be coughed from deep in the lungs and not saliva. The patient should not clean their teeth or use antiseptic mouthwash prior to producing the sputum sample. 3 early morning sputum urine samples not pooled. Transport to the laboratory immediately, or if delayed, refrigerate immediately. Examples of specimens rejected are feces, urines for the diagnosis of pulmonary TB, salivary specimens, tissues in fixatives, dried swabs. This part of the process takes approximately 1 hour. Once evaluated and labelled, all specimens are transferred into new sterile universal containers, where respiratory samples are liquefied, tissues are cut up very small using scalpels and glass beads. All specimens are then spun at a very high speed in the centrifuge for 15 minutes in order to concentrate down the specimen and any mycobacteria present in the specimen. This part of the process takes approximately 1 hour. Once spun, the supernatant is removed, leaving a pellet of concentrated material at the bottom of the container. A thin monolayer of material is placed on a slide. The slide is placed on a hot plate for a minimum of 10 minutes to fix the material to the slide. The slide is then treated with a solution containing phenol for 5 minutes to render the material non-infectious, thus allowing laboratory staff to handle the slide safely. This part of the process takes approximately 45 minutes. The slides are placed in a cassette and loaded onto a staining machine, where they are stained with Auramine O. A positive and negative control slide is included on each run. The staining process takes approximately 35 minutes. Once air dried, the slides are ready to read. The smears are read using an LED fluorescent microscope. The entire smear is read. Each slide takes a minimum of 3 minutes to read. This part of the process takes approximately 1.5 hours to 2 hours. A nucleic acid amplification test, NAAT, is performed on all new smear positive samples, or, if clinically requested, on smear negative samples. This is performed using the GenExpert system. The decontaminated samples are centrifuged for 15 minutes and the concentrated samples are cultured into an MGIT tube, liquid culture, and 2 LJ slopes, solid culture. This part of the process takes approximately 1 hour. The MGIT tubes are then incubated in the MGIT instrument for up to 6 weeks. LJ slopes are incubated in a 37-degree incubator for 8 weeks. The The MGIT instrument will alarm when a tube becomes positive. This is removed and an aliquot is tested for mycobacterial growth by ZN staining. MTC positive cultures typically display this cording pattern. If ZN positive and the appearance on ZN staining suggests an MTC, then an MGIT TBC test is performed. This can detect the presence of MTC in 15 minutes. Atypical mycobacteria and further speculation of MTC isolates are identified using a molecular baseline probe assay. These assays are batched and performed on a weekly basis. Sensitivity testing is performed on the first MTC isolated from a patient. This can take up to 14 days after becoming culture positive.